All right, so the first thing we're gonna do is we're gonna put a little antiseptic around the main wart, and then we're also gonna do the next biggest wart there. Oh, and this one right next to it. So we can probably take out 3 of them today. All right, so the first thing I'm gonna do is I'm just gonna check and make sure. Now you'll feel pressure. I just need to make sure, do you feel anything sharp when I do this, or just pressure?
So far just pressure.
Okay, then if you didn't run screaming from the chair, you can relax, because you're not gonna feel anything that hurts. So what I'm doing is I'm just kind of, with a blunt instrument, I'm separating this wart from the tissue, the skin around it. We call this a blunt excision. And these do bleed a lot because there's lots and lots of little blood vessels around it. You okay?
Yeah.
Okay. How are you doing, patient?
Okay.
Okay. All right, so now that we have, this can go all the way around like that, and you can see this is all in one piece here. Then I can take my curette, my little scooper, and we're gonna go down to the base of it and just scoop it right out. And again, they bleed a lot. Possibly could have injected some anesthetic with epinephrine around it, but he's so numb I didn't see a reason to do that. It would help the bleeding, but okay. And you can see right here, this little pearly white stuff right there, that's the actual wart. And it, again, it forms a capsule around itself, and that's the bottom of it right there. So we're just gonna take that out, and again, you can see, whoop. Well, I guess we're not gonna see, it's on the floor. Okay. So that's the main, that's the, what we call the mother wart. So I'm just gonna I'm gonna scrape the bottom of it a little bit to make sure we got all the wart cells out. And then we're gonna put a medication at the base that will kill any remaining cells. It'll also cauterize some of those blood vessels, so it doesn't bleed quite as much. Okay. Then let's go to the next one right here. And we're going to do the same thing here. It's a much smaller one. So we call this a satellite lesion. Yeah, I probably should have put some epinephrine in there, but that's okay. There's another little piece there. And then the last one, which is right here. You see that one?
Mm-hmm.
It's also pretty small. We would call it a satellite lesion. So again, we're gonna circumscribe it, separate it from the skin around it, and out it comes. Scoop the base, and scoop the base of this one. You can see with pressure a lot of that bleeding has already stopped. And so now this will go into the small little hole down to the base, and this one down to the base. Okay. Can you? And then this is just some plain old alcohol. We're just kind of rinsing everything off. And then we put a little bit of antibiotic cream on these, and then a lot of gauze, because between here and the car it is going to bleed. But when you get home, if you just elevate it for a couple hours, it'll be fine. Let's clean some of this off. All right, we are done. Thank you for letting us do the video. Okay.